Patient has unilateral headache associated with nausea and vomiting and swelling on the side of the head of the headache and speech disturbance while the attack, and since last 2 months he has 4 days one episode. So he was diagnosed as common migraine and was given prophylactic in the form of amitriptyline and flunarizine and propranolol. Another patient had loss of balance and giddiness and associated with migraine and same treatment prophylaxis as discussed. So headache, if it is more than 4 hours, it can be chronic migraine or chronic tension type headache or hemicrania continua or new daily persistent headache. If it is less than 4 hours, chronic cluster or chronic paroxysmal hemicrania or SUNA or hypnic headache. Secondary headache, post-traumatic, inflammatory or chronic infection or medication overuse headache. Common migraine is most common, throbbing pain on one side, worse with physical activity, and headache lasts for 4 to 72 hours. Whereas classic migraine, migraine with aura, recurring headache that occur with or after aura. Aura can include visual disturbance, tingling, difficulty in speaking, nausea, vomiting. Classic migraine has prodrome, aura, headache phase and postdrome phase. Whereas pathophysiology, vascular vasodilation, cortical spreading depression and inflammatory pathophysiology. Triggers include external and internal factors. Types of migraine at least 5 headache plus following criteria. In case of without aura, and with aura at least 2 headaches plus following criteria. Types of migraine: retinal, brainstem aura and hemiplegic migraine. These are migraine variants. Red flag signs: neurological symptoms or thunderclap headache and systemic signs. Workup: imaging, eye exam, blood workup and lumbar puncture. Non-pharmacological treatment and avoid medication over usage and supplements. Treatment options: NSAIDs, triptans and dopamine antagonist, and preventive therapy for migraine, which include beta blocker, tricyclic antidepressants and anticonvulsants and serotonergic drugs. So cluster headache and paroxysmal hemicrania and SUNCT, these are all less than 4 hours in duration. Sumatriptan 50 to 100 mg are not effective in migraine with aura unless given after the aura is completed and the headache is initiated. Side effects are often mild and transient, and it is contraindicated in cardiovascular or cerebrovascular disease. Recurrence of headache is another important complication. Next, it is often combined with NSAID, naproxen 500 mg. Sumatriptan will augment the effect of relief of headache. If oral NSAID triptan agents fail, addition of dopamine antagonist metoclopramide 10 mg is beneficial. For prevention 2 to 12 weeks before the effect is seen, we have to give propranolol or tricyclic antidepressants and flunarizine. But phenylazine and methylsergide are reserved for late resistant cases. Phenylazine MOA inhibitor contraindicated with tyramine food containing foods and decongestants. And methylsergide cause retroperitoneal cardiovascular fibrosis. So tension headache is basically without any accompanying features like nausea, vomiting, photophobia, phonophobia, throbbing or aggravation. It is band-like sensation. So treatment include generally with simple analgesics like acetaminophen, aspirin, NSAIDs and behavioral therapy. For chronic tension headache, amitriptyline is the only proven treatment. Cluster headache is usually retroorbital and at least one of the daily attacks of pain recur at the same hour each day for a duration of cluster bout. Typical cluster headache has daily bouts of 1 to 2 attacks of relatively short-term duration unilateral pain for 8 to 10 weeks a year. This is usually followed by pain-free interval that averages a little less than 1 year, characterized by chronic pain when there is no significant period of sustainable remissions. Generally perfectly well between the episode. Onset is nocturnal in about 50%. Men are affected 3 times more than women. Patients with cluster headache tend to move about during the attack, spacing, rocking and rubbling with their head for relief. Some may given the aggressive movements during the attack. This is contrast to migraine. and have parasympathetic autonomic activation symptoms like conjunctival injection or lacrimation, rhinorrhea or nasal congestion. Treatment of acute attack include 100% oxygen 10 to 12 liter per minute for 15 to 20 minutes and sumatriptan's 6 mg subcutaneous rapid onset given shortens the attack for 10 to 15 minutes. There is no evidence of tachyphylaxis. Nasal sprays formulation also available. Short-term prevention in case of episodic cluster headache, prednisone 1 mg per kg up to 60 mg per QID or methylphenidate verapamil. And long-term prevention include verapamil, lithium, methylphenidate, topiramate, gabapentin and melatonin. SUNA is unilateral headache with at least 20 attacks lasting 5 to 240 seconds with ipsilateral conjunctival injection and lacrimation is there. And treatment acute, there is no treatment, and however in hospitalized patients IV lidocaine is given. And preventive therapy, long-term prevention is lamotrigine 200 to 400 mg per day or topiramate or gabapentin may also be effective. Carbamazepine 400 to 500 mg per day has been reported by patients to offer modest benefit.
अगर आपको एक साइड में पूरा दर्द हो रहा है along with some bright flashes या आपको उल्टी जैसा फील हो रहा है, ये माइग्रेन हो सकता है. Consult a doctor and try this home remedy of dipping your legs in hot water along with salt. अगर आपको यहाँ बैंड जैसा हेडेक हो रहा है, then it is tension type of headache, so cut down your stress. अगर आपको डिफ्यूजली सर दर्द हो रहा है या पीछे की तरफ सर दर्द हो रहा है, then please check your BP. अगर आपको इसी जगह में दर्द हो रहा है या टच करने में पेन हो रहा है, फिर ये साइनस हेडेक हो सकता है. स्टीम इनहेलेशन शुरू कर लेना. अगर आपको पीछे की तरफ या गर्दन में दर्द हो रहा है, ये सर्वाइकोजेनिक हेडेक हो सकता है, सो फिजियोथेरेपी शुरू कर लेना. अगर आपको एक साइड पूरा दर्द हो रहा है एंड यहाँ भी दर्द हो रहा है along with lacrimation and nasal congestion, ये पैरोक्सिस्मल हेमिक्रीनिया हो सकता है. कंसल्ट अ डॉक्टर एंड गेट MRI डन.